moving on to health matters this evening. As we step into a new year, many people set intentions to live healthier, be more active, and take better care of themselves. But one of the most important and often overlooked steps in that journey is a proper health checkup. Knowing where your body stands can help prevent illness, detect problems early, and give you peace of mind. Joining me today is Dr. Nelson Makemba, general practitioner, who will be helping us understand what a full health checkup really entails, who should be doing it, and why it's such an important investment in your long-term well-being. Doctor, good evening and welcome.
Good evening to you, Nina. Thank you for having me, and good evening, Namibia.
Thank you so much for being here, Doctor. To start off, Dr. Makemba, when we talk about a full health checkup, what does it actually mean, and what is it that people should expect?
Yeah, when you go to a doctor or a healthcare provider for a full medical examination, you are looking at a series of events that involve taking a proper history, looking into your family history, trying to establish if there is any genetic predisposition to certain medical conditions, looking into your lifestyles, in establishing whether your lifestyle might place you at risk of certain problems, and then further to that, then you move on to doing proper examination. You start off with a physical examination, then you might run some blood test, and then you can send them in for certain images like ultrasound, mammograms, and so forth. What you're then trying to do is you're trying to use all this data that you will be gathering by doing these exercises in establishing if there's a problem or not, and if there's a problem, what is the solution? What are we going to do about the problem? And if there's no problem, then we offer a tailor-made sort of roadmap advising your patient as to what to do in order to stay healthy. And if there's a problem, what to do so that the problem doesn't become severe, for instance. And then once you've placed and put all that together, then you are able to sort of provide a roadmap for your patient, so they can lead a healthy lifestyle.
Talk to us about the key components for comprehensive health checkup when it comes to adults.
Having done a history, then you can move on to doing blood, for instance. You can check their lipid profile, for instance, things like lipogram, looking at their cholesterol. You might want to check their sugars, for instance. You might want to look at the kidney functions. You might also draw blood to look at some cancer markers, breast, PSA, which is a prostate-specific antigen test for males. You might then want to send, for instance, a female for a breast ultrasound or a mammogram. You might even want to do a pelvic ultrasound to looking at the uterus and the ovaries. These are some of the basic things that one routinely does. And then an STD screen can also be done, depending on the risk profile of the individual in question. Yeah, those are some of the stuff that we commonly tend to do, particularly in the adult population.
When you say the risk profile of an individual, what is it then that you look at with that? Because I would think that you would do an STD screening for absolutely everybody.
Look, I mean, when you sit with a patient in front of you, for instance, and you start engaging them, asking questions, if it's, for instance, an individual that has not engaged in sexual activities in the longest of time, and probably there's not necessarily any risk of contracting sexual-related illnesses. And the patient might even, they themselves say to you, I don't think that is necessary at this point, so I have not been engaging in activities that have placed me at risk. So you take it from the patient's history that, there's no risk there, so maybe not necessary. But majority of, adults probably would, say, we might as well do it, but you might find one or two individuals that says probably is not necessary at this stage.
Yeah. Doctor, are there any certain tests or screenings that, everybody should do, regardless, even if they feel that they're in a very healthy state?
Yes. Things like routinely checking your blood pressure as an adult, probably you might need to do that because that's a silent killer. Sometimes you don't feel anything, even if the numbers are not looking so good. You might want to check your weight and then work out your body mass index. You might then want to check the sugars, especially, if you come into, with a picture of a family history of diabetes, for instance. You might want to check your cholesterols and lipograms, kidney functions as well. As we grow older, depending also on our lifestyles, for individuals that may be drinking somewhat excessively, that might also give them, a poor kidney function that might lead to kidney failure. So you might also want to draw blood to check your kidney. Cancer screening, quite commonly done these days because, it's one of those, one of the problems that we are actually seeing quite commonly these days. And oftentimes the problem with cancer is that if not picked up early, then by the time it's picked up, it might have rather spread to different parts of the body,
Right.
and there's little that can be done. But then the idea is if it gets picked up early and then early intervention is instituted, you might actually be able to, beat the problem. Yeah, so those are some of the things that, one might find, as healthcare providers, encouraging our patients to routinely do, even if they are not feeling unwell.
When you say routinely do, that brings me to my next question. How often should one do a full health checkup, or does it, is it age dependent?
Yeah, by far, really, individual age between 18 and 30, 2 to 3 years is probably good enough. Between 30 and 50, a year to 2 years, and then over the age of 50 annually. But obviously, you have to take into an account, an individualized approach.
Yeah.
If somebody is having a family history of cancer, for instance, their approach might be different because there's a risk that, is there. Or if they have a family history of, diabetes, for instance, you might encourage them to check as often. And then obviously, those, routine follow-up then become individualized based on the clinician that is treating you and, the kind of risk that, you're presenting with.
Yeah. Doctor, a lot of people avoid going to the doctor unless they feel unwell. But I want you just to stress this evening to our viewers why preventative healthcare is so important.
Yeah, preventative healthcare is important in a sense that first and foremost, it promotes quality of life, higher quality of life. And then also, what tends to happen is that, the cost involved in the care for the patient, if you get to be given to going routinely for evaluations and, a problem is picked up early, and an intervention is instituted early, it might actually, save you a lot of cost, because when there's complications, and there's multi-organ involvement and the diseases spread and stuff of that nature, the cost for care then, going forward, become humongous. You might end up being hospitalized for the very longest of time. And the burden also on the resources and the health fraternity becomes, way more when people are rather presenting already ill as, opposed to, coming in routinely, getting evaluated and leading a healthy lifestyle.
Doctor, what are some of the common health issues that you pick up early through routine checkups with patients that, they didn't realize that they had?
You might pick up a dyslipidemia where the lipid profiles are deranged, for instance. The cholesterol is quite high, and that has an implication in your health, especially with your circulatory system and your blood pressure and so forth. You might pick up, a poor kidney function, that then might mean you have to rearrange the kind of food you eat, your lifestyle, because, if you go on the same trajectory, you might find yourself having a full-blown kidney failure, needing renal replacement therapy such as dialysis. Individual actually might discover they have cancer even though they are feeling very well. So drawing those bloods and doing those mammograms, for instance, can be helpful. And the lesion might be localized to a specific anatomical region where if a surgical intervention is instituted and it's removed, it might just be the end of, the problem. Yeah, so it's very important really that one, get to go and do those routine checks. Sometimes you might find that you get an impaired glucose tolerance. You might not necessarily be diabetic, but, your body is actually telling us that you are not able to, manage that sugar, very well. And then we can then, encourage you as to what type of food to eat. Might even, send you to a dietitian for further guidance, and then you might be able to cut out some of, those things that could have, tipped you over into becoming full-blown diabetic. And even if you are going to at least delay, so that, if it happens later in life.
Just lastly, this evening, Dr. Makemba, what simple lifestyle changes, can people start making to support, better health throughout this year?
Yeah, simple things like nutrition and hydration. Watch what you eat and make sure that you drink enough fluid. I always tell my patient, a balanced diet doesn't have to be very expensive. Just make sure that, you have all the ingredients in your food. Avoid, these harmful habits.
Yeah.
Smoking, drinking, engaging in, with multiple sexual partners and stuff of that nature. Those might place you at risk, for instance. Make sure that you rest very well and, get some peace of mind, So just, taking off from work sometimes and just, taking care of yourself, that goes a very long way. And, get off that couch and, move a little bit. Exercises goes a very long way. It helps, improve your health, dramatically. So if we can just institute these very basic things that, one can do every day and, activities like exercising doesn't necessarily always involve signing up at the gym if you can't afford one. Just taking a walk, for instance, jogging, for instance, or just going for a run. You don't have to pay nobody to do that. Yeah, those are the simplest things that people might institute, especially at the beginning of this year, in order to make sure that their health status is well maintained throughout the year.
Yeah. Well, Doctor, thank you so much for joining us. We appreciate it.
Thank you for having me. It's always a pleasure being here.
And that was Dr. Nelson Makemba speaking to us there. We'll be right back after this break. Stay with us.